These are composed of doctors, nurses, and other hospital employees who are continuously trained to handle any kind of emergency. In case of fire, these are the things you should remember. 1. Do not panic. Keep calm and figure out what you can do to get to safety. If you happen to discover the fire, dial Local 4 immediately. Report the fire's exact location. You can also inform the Medical City personnel nearest you. During a fire, bring only what is already on your person. Never attempt to rescue your things. Instead, leave everything and let the fire brigade do their job. When you already know where to go, walk as fast as possible, but not so fast that you start bumping into things or lose sight of where you are going. If you don't know where to go, consult the emergency route maps at the back of the door of your room. You can also ask assistance from the first Medical City personnel you see. Emergency exit signs located on every floor of the building can also be followed. These will show you the way to the stairwell or to a door leading out of the building. Never use the elevators. Use only the stairs. In case you are unable to get out of the building, these are the things you should try to do. Again, do not panic. Keep calm and be aware of your surroundings. If you are inside a room where there is no smoke or fire, close the doors and windows immediately to minimize the entry of smoke. Make some noise to call the attention of the rescuers. Use a belt, shoe, or bag to hit the walls, doors, and exposed pipes. If you are located in one of the higher floors, never attempt to jump. If there is thick smoke blocking the nearest exit, take a deep breath and hold it as you make your way through. If the smoke is too thick and heavy, make your way to the exit by crawling. The air up to 15 inches off the floor is usually smoke-free. You can also try to cover your nose with a damp piece of cloth or towel. If you are injured during the fire, seek medical treatment immediately after getting out of the building.
The most important thing to remember during an emergency is to keep calm. Do not panic.
The hospital staff has been trained to take care of you and your loved ones in case of an emergency. Because here at the Medical City, we are concerned not just with your health, but with your safety and security as well. Hi, I'm Dr. George Concepcion.
And I am Mrs. Virginia Alano.
We're part of the Medical City's Emergency and Disaster Response Team.
Today, we'll be showing you the different safety features of the hospital building.
And we will also be giving you pointers on what to do in case of an emergency. Because here at the Medical City, your health and your safety are our primary concerns.
The Medical City building was constructed with the health and safety of its patients and guests in mind. Numerous structural and biosafety features have been built into the hospital, making the Medical City one of the safest buildings in the country. The Medical City building is so safe, in fact, that its structural design is 200% above that required by the Philippine Building Code. This means that it is 200% safer and 200% more secure than most structures here in the Philippines. One of the key safety features of the hospital is the placement of seismic gaps when the building was built. These gaps allow the building to withstand earthquake tremors, keeping patients and guests safe and allowing ample time for people to evacuate the building when necessary. All the walls and doors of the building are also fire-rated to withstand very intense fire. This means that they will not crumble or collapse even after being exposed to fire for up to 2 hours. The walls of the building have also been coated with the Level 5 antibacterial paint. This prevents the growth of mold and mildew and maintains the highest level of hygiene in the operating room, the ICU, and other critical areas of the hospital. HEPA filters have also been installed in the air ducts of the hospital, assuring all patients and visitors that the air they breathe while inside the hospital is clean and bacteria-free. Positive and negative air pressure zoning is also present in critical rooms of the hospital. Negative air pressure zoning is used when contaminated air needs to be sucked out from a room. This usually applies to autopsy rooms, body holding rooms, isolation rooms, and decontamination areas. Positive air pressure zoning, on the other hand, is used when clean air needs to be pumped into a room. This is used for linen storage rooms, clean work rooms, the OR, the nursery, and even the recovery and trauma rooms. Positive and negative air pressure zoning is necessary to keep personnel safe and to protect critical environments, processes, and equipment from contamination. A safety feature called smoke compartmentalization is also in place. This means that in case a fire breaks out in a certain area of the building, the smoke will not seep into other areas. This allows safety personnel to address the isolated incident immediately and keeps patients and guests in other floors safe and smoke-free. For those on the affected floor, however, there is what is called a refuge area. This is located at the elevator lobby on each floor of the building. The refuge area is a space protected against fire and smoke. All patients are immediately brought here in case of fire. A 24-hour building management system, or BMS, is also installed to monitor the status of all the rooms in the hospital, making sure that no fire or emergency occurs unnoticed. Apart from these structural and biosafety features, the hospital is also equipped with various safety tools. Smoke detectors have been installed in every room of the hospital. Their sensors are connected to the hospital's BMS. This means that if one of them goes off, the hospital staff is immediately notified. Water sprinklers are also present in every room. These are always checked to make sure that they are in working condition. All hospital rooms are also furnished with evacuation route maps. These maps will show you the fire exit nearest to your room with directions on how to get there. Patients and guests must read these maps for their own safety. A device called a room annunciator also monitors every patient's room. These are installed at the nurse's station and will sound an alarm in case there's any smoke or unusual activity on the floor. Fire exit signs are also located on every floor. These will light up in case of an emergency and will show patients the nearest fire exit. Opening the door to any fire exit will activate the fire alarms and will also turn on the pressurization of the stairwells, protecting the area from smoke. Also located on every floor are pull stations. A patient or guest who sees an explosion or fire anywhere in the building is encouraged to break the glass casing and pull the switch. Fire extinguishers are also located on every floor. Only authorized personnel, like members of the hospital's disaster response team, should use the extinguishers. The same is true for fire hoses mounted on the hospital's walls. Like the fire extinguishers, they are to be used only by authorized personnel and not by patients or guests. Aside from these safety tools, some safety guidelines are also enforced in the hospital for the security of patients and guests. All visitors are screened by guards. Authorized visitors or those who have business to conduct with the hospital must wear their visitors' IDs at all times. A strict no smoking policy is enforced on all areas of the hospital. No firearms are allowed inside the hospital. Alcoholic beverages of any kind are not allowed. Electrical appliances are also prohibited inside patients' rooms. Children below 7 years old are discouraged from going to restricted or isolated areas like the ICU, NICU, nursing stations 6A and 14A. Patients and those assisting them are reminded to always lock the doors of their room. For possible threats, hazards, or concerns, please approach any medical city personnel or dial local 4 from the phone in your room. You may report any incident to this emergency number. Do not entertain any prank calls. An emergency and disaster response team has been assembled by the medical city and is assigned per floor. These are composed of doctors, nurses, and other hospital employees who are continuously trained to handle any kind of emergency. In case of an earthquake, these are the things you should remember. 1. Do not panic. Keep calm and figure out what you can do to get to safety. If you are inside the building, stay where you are. Do not run to the nearest exit. If you are in a room, leave the doors open. Stay away from windows. Move away from chemicals. Stay away from high voltage electrical equipment. Keep away from compressed gas systems. After the main quake, when things settle down, find the nearest exit, get out, and go to the designated assembly area. Never use the elevators. If you are near the elevators, do not go in. Instead, stand outside the cars against the walls in between the elevators. These walls are some of the strongest structures in the whole building. When outside, stay away from loose objects and structures that may fall and injure you. If you have been injured during the earthquake, seek medical treatment immediately after you are able to leave the building.
The most important thing to remember during an emergency is to keep calm. Do not panic.
The hospital staff has been trained to take care of you and your loved ones in case of an emergency. Because here at the Medical City, we are concerned not just with your health, but with your safety and security as well.